Hey everyone, welcome to this new video. In this video, we are going to talk about an obstetrics case. But first, don't forget to subscribe to our YouTube channel and keep the notifications on. Now let's start the case. Mrs. M is 25-year-old married waitress currently residing in LA. She is self-referred and reliable. In chief complaint, she says her stomach aches and she's got vaginal bleeding. In present illness, Mrs. M complains of abdominal pain that has started gradually since yesterday, while she was resting. It has been intermittent. She localizes the pain mainly in the right lower quadrant, and it's sharp. Also, it doesn't radiate to other sites. She can't think of anything that worsens or relieves her pain. The abdominal pain doesn't relate to GI and urinary problems. She also complains of vaginal bleeding that has started with the abdominal pain. Vaginal bleeding has happened twice, but it's not much and only stains her underwear. Patient is stating that she has been tested and in fact is pregnant. In her past history, she doesn't mention any childhood illnesses, medical history, surgical history, or psychiatrics. But in obstetric and gynecologic past history, she says about 4 months ago she had a STI that has been treated based on a note of gynecologist. Now moving on to the next page. In drug history, she doesn't mention any medications. In family history, she says both of her parents died at age of 67 years in a car accident. Only her father had hypertension controlled by medication. She doesn't have any brother or sister and there is no family history of diabetes, heart or kidney diseases, cancers, and any other disease. Personal and social history. She is 25 and has been married for 1 year. She has been working in a restaurant for 4 years. She doesn't have any children. She smokes 1 pack a year, but she hasn't done that for 2 months and also doesn't drink any alcohol. For calculating the number of pack years, you need to multiply packs smoked per day by years as a smoker. Or since there are 20 cigarettes in 1 pack, you could just divide the number of cigarettes smoked per day by 20 and then multiply that by number of years smoked, as you can see in the picture. Physical examination. In general, she is a young woman who responds quickly to questions. She lies on the bed with mild abdominal pain. Now, the vital signs is very important for us. And here she has a respiratory rate of 17, blood pressure 120/90, temperature 37.1, and heart rate of 89. As you can see, her vital signs indicate that she is stable for now. Her skin color is good and her palms are warm but not moist. As you can see in head, eyes, ears, nose and throat, there is nothing pathological. Her pupils are equal round and reactive to light and accommodation. She doesn't have conjunctival pallor and also not icteric sclera. In her neck examination, there is nothing pathologic and her lymph nodes are small, soft and non-tender. Now moving on to the next page. As you can see, there is nothing pathologic in thorax and lungs, cardiovascular, and breasts, but she has tenderness in lower abdomen. Genitourinary. A speculum examination revealed uterus is the source of bleeding and amount of bleeding is not significant. As you can see, the rest of her physical examination is normal. Laboratory findings. Urine beta-HCG qualitative is positive. Assessment and plan. As a summary, she is a 25-year-old woman with abdominal pain and vaginal bleeding for 1 day and a positive beta-HCG. Now, with these symptoms, the most important differential diagnosis is ectopic pregnancy. For ectopic pregnancy, first we need a history and physical examination. Then we need to determine whether the patient is hemodynamically unstable or stable. If she is unstable, she should undergo surgical treatment. But if she is stable, we need to perform TVS. And based on the results, if the TVS is diagnostic for EP, the medical or surgical treatment should start. But if it's non-diagnostic, we need to measure the serum HCG. Then the serum HCG is above or lower than the discrimination zone. Discrimination zone is considered as 3510. If it's above that and EP is a great concern, we need to perform D&C. But if there is no evidence of EP, we need to measure serum HCG in 48 hours. If it's lower than discrimination zone, we need to measure serial serum HCG every 48 hours. If HCG increases above 35%, then potential intrauterine pregnancy is considered. If HCG increases lower than 35%, then abnormal pregnancy is considered. And if HCG is plateaued or decreased, then failed pregnancy is considered. Then we have to repeat HCG every 48 hours until decrease is confirmed, and then every week until HCG is undetectable. Thanks everyone for watching us. If you like this video, don't forget to hit the like button and also subscribe to our YouTube channel and keep the notifications on.